You're watching Fever FM and I am RJ Vivek. And by the way, do you know stroke is a major global public health problem? In fact, in India, stroke is increasingly becoming the main reason for premature deaths and disability. As per World Stroke Organization, one out of every four people has a chance of suffering from a stroke in their lifetime. And that's not all. In our country, around 1.8 million people suffer from a stroke, and very few manage to reach a hospital in time. That's some serious food for thought, right? And that's why we have invited our guest for today, Dr. Noufal Basheer, to talk about this. Sir, how are you doing?
I'm fine. Good afternoon, Vivek.
So, what is a brain stroke and how severe is the disease?
As we all know, brain is the controlling center of all our body. It needs constant supply of oxygen and other nutrients through the blood circulation. Cutting off the blood supply to the brain will lead to death of brain cells, and which is progressive in every minute. Every minute, 2 million neurons are lost, and this process is called stroke. It could be due to two reasons. One could be because of blockage of the blood vessels, leading to ischemic stroke, and the other one is rupture of the blood vessel causing hemorrhage. 87% of the strokes are due to ischemic stroke. That is what we are concentrating more these days.
So, what are the symptoms of stroke and how to recognize if someone has stroke?
So, common signs of the stroke can be remembered with the word fast. Fast, F stands for facial deviation, and A stands for arm or limb weakness, which can be either one sided weakness or weakness of both sides. S stands for speech difficulties, slurring of speech, finding difficulty to find words, and T stands for time. It's time to rapidly reach a comprehensive stroke treatment center. So fast is the key word to remember to identify stroke.
How can stroke be prevented, sir?
So 80% of the stroke are preventable, just like what we say heart attacks are preventable. But stroke is synonymous with brain attack. Stroke can be prevented by controlling modifiable risk factors, including eating junk foods. So you should have a healthy and balanced diet, control blood pressure, diabetes, reducing cholesterol, reducing alcohol intake, stop smoking, and physically active. And that is why the theme of this year's stroke day is join the movement. You have to be active so that you can prevent the chances of getting a stroke.
What are the treatment options for stroke?
Mainly, there are two options for stroke. It mainly depends upon the time when the patient reaches. Whatever we say, one has to reach as early as possible to a comprehensive stroke care center so that we can save disability and save life. If patient reaches within 4.5 hours, we can give a medicine which dissolves the clot and opens up the blood vessel. It is called thrombolysis. The drug used is tissue plasminogen activator, that is called as IVTPA. But after 4.5 hours, the success rate is very, very less. So after 4.5 hours, the other option is available. That is just like angioplasty, which we do for myocardial infarction or heart attack. We can pass small catheters and introduce a stent retriever like thing and remove the clot, thus opening up the blood vessels. This can be done up to 24 hours depending upon the selection criteria based on specific MRI or CT sequences. So these are the two main treatment methods available these days.
Sir, why is there so much discussion about time when we talk about stroke?
So as I said, stroke is emergency and every second counts. Every minute, 2 million neurons are lost. So every minute saved is 2 million neurons saved. So in order to prevent disability and in order to save life, we need to treat a patient as early as possible with either thrombolysis or mechanical thrombectomy after 4.5 hours.
A recent report says that COVID-19 patients have higher risk of stroke. Is it true? If you can explain.
Yes, there are reports that COVID increases the risk of stroke. Basically, COVID has a hypercoagulable state, meaning the blood gets clotted inside the blood vessels, thus decreasing the blood flow into the brain, causing stroke. So we have much more increased risk of stroke during COVID times, directly related to COVID. Also, indirectly, because of COVID, patients are not going to hospital and not taking care of their hypertension, diabetes, and cholesterol and other risk factors. And because of that, also, there are a lot more incidents of stroke these days.
Thank you, sir. Thank you so much for your time and for such great insights, doctor. And I'm sure your words of wisdom and experienced medical advice will help a lot of our listeners. Let's be sure to remember the health tips and practice them. Prioritize our health above all. And this stroke day, let's promise to take care of ourselves and the ones around us. Stay tuned to Fever FM.